All right, Mr. President, thank you so much for engaging with us. I've got two quick questions. The first one is around the communication by your administration. There are some ministers and some South Africans that have raised concerns around the tone of some of the ministers when they speak to us as the nation around the lockdown regulations. Some regulations, it appears, are made up as the ministers go. You know, things like if you are found with smoking, you may be asked, where did you buy this? Can you produce a slip to prove that you have purchased this and where you purchased it from? So how concerned are you about that communication, the tone, and the fact that there is just some discrepancy in terms of the regulations that the ministers are putting forward? And how do you plan on strengthening communication to avoid confusion? My second question is on the lifting on the ban on the sale of cigarettes. I want to ask, Mr. President, who advised government initially when you announced that the ban on the sale of cigarette would be lifted? Did you consult with the health experts? I'm asking this because when that decision was reversed, we were told that it was reversed because the experts have advised that the sale of cigarettes must continue to be banned. So who actually advised initially? Where did you get the advice on the lifting of the ban on the sale of cigarettes? Thank you very much.
What is set out in the regulations and what is finally also implemented. And you give a very graphic example on, for instance, cigarettes. And you say, there's a ban on cigarettes and, then the police will follow a person up to a point where they say, where did you buy? Where is the slip? And all that. And I would say that on the communication side, we have spoken about this very recently, and I have been saying to the ministers that let us make sure that our communication is clear, direct, and that we should not be seen to be contradicting some of the things that we say on an ongoing basis, or misinterpreting also some of our own regulations. And we need to tighten up the communication. I think what you can admit is that there has been transparency in communication from government, and government has been communicating on a regular basis. And yes, there will have been occasions, and there are occasions where the communication might have slipped and might not have been spot on. That we will concede to. And also, the very graphic example that you gave, Clement, is over-enthusiasm. Over-enthusiasm. When we imposed the lockdown, we said, and I said this specifically when I addressed the police and the soldiers, that we should not be going out there amongst our people as though we are confronting an enemy. We are not enforcing something that is enforced during a wartime, where there are bombs, blasting all over. It is a process of encouraging our people to act in a way that is going to save lives. That I communicated very clearly. And of course, because we are dealing with so many people, so many officials right across the country, there would have been, and there are, those whose enthusiasm actually goes ahead of them. And what we do need to do, and even at my level, is to continue reinforcing this message right across the board, including amongst my own colleagues. So that is a point well taken. The issue of the cigarettes, what advice did we rely on when we initially said the cigarettes could be sold? Of course, we rely on a variety of advices. And we also take time to discuss those. Of course, there are quite a number of doctors and professionals who advise us about the dangers of cigarettes, of smoking rather. And at the same time, in the National Coronavirus Command Council, when we discussed it, we looked at the point at which we could actually ease the restriction on cigarettes. And when the initial decision was taken, we obviously had also gleaned on the advice that was there from the medical field. But at the same time, we felt that because people do smoke in our country, there needs to come a time when the restriction will be lowered. And when I did announce that we were lifting the ban on cigarettes, and later changed it, the change came about as a result of a flurry of concerns and objections that were raised by a number of South Africans in their thousands. We then had to go back to the drawing board and then finally announce a change. And now, obviously, people have taken issue with the way the announcement was made. It was made by Minister Dlamini Zuma. And what we should have done is, the president having announced it, the president should have been the one to announce it again and give reasons why this was being changed. Now, that was not done. That was not done, and we will concede that as well. It should have been done because then it created a very unpleasant type of situation where people started saying that the minister was undermining the course of the other regulations that were being announced. And let me say that, yes, we continue to follow scientific advice.
Mr. President, there seems to be a disconnect between some of the announcements that you make and the implementation thereof by the executive. I know you speak about the capability of the state and how it's been improving, but there seems to not be any consequence management in terms of departments or ministers unable to follow through on the announcements that you make, whether it's the 350 Rand grant, whether it's now the crisis with the schools. Do you have any measures in place to deal with this, to say I've announced A, B, and C, and how well is this being executed? And then can we see some transparency in ministers being held accountable for not following through on the announcements that you make?
Now, as I've said repeatedly, one of the challenges that we've been facing, which I have identified over and over, is the capacity of the state. The state that, if you like, I inherited has been a weakened state in a number of ways. And much of what we've been trying to do is to show up the strength of this state. The district development model is one pillar around which we want to strengthen the state and destroy the silo mentality of doing things in government, where one department does not know what the other department is doing, and where we can enhance implementation of decisions that are taken. Now, as we enhance this capacity of the state, of course, there will be a number of instances where there are weaknesses and where, for instance, there is no proper follow-through. I mean, you give a very good example, about the implementation of the payment of the 350 Rand to the unemployed people in our country. We took the decision, and having taken the decision, and in a way, this decision was like unexpected to those who would implement it, because they had to craft a new way of paying an amount of money to people who were not on their books, who were not registered with them, who were not in the system. So a system had to be put in place, and it had to be built from scratch. And they obviously had stop and starts, and they obviously had breakdowns and what have you. Now, I'm assured that the system is now working, and they have already paid almost 120,000 people, and they are going to be processing almost 600,000 people in the next few days, and we will be getting up to what we believe will be about 3.5 million people. Now, that is a phenomenal process because many of the people don't have bank accounts. And you then have to find a way of paying them, either through e-wallet or whatever other platform. Some of them have bank accounts. You've got to validate them. You've got to find those people. You've got to check with SARS, Home Affairs, and everyone else. So all that process is now being done. And they show me they've done already 3.5 million. We've been validated and checked rather, and thereafter payment is going to happen. So the capacity of the state has been a major issue. Will there be consequence management? Of course, there will be consequence management where my colleagues, ministers, or even officials do not act in accordance with what they are supposed to do. COVID-19 has given a further boost to the capacity of the state. And I want to capitalize on that.
My question is about the special COVID distress grant, which you said 6.5 million people applied. You're aiming for about 3.5 million receiving that grant. Does government foresee that this grant will become permanent? And if not, when do you foresee it will be suspended? Thank you.
The COVID distress, do we see this? It was from Willem. Do we see this as being permanent? No, our current plans are that this is a COVID-19 time-limited or bound distress assistance. And given the resources that we have in government and the resources that we need to put in place to dig our way out of the hole that COVID-19 is depositing us into, because we're still going deeper into this hole, we will not immediately have these resources. What with our revenue source shrinking, we saw and we had the commissioner of SARS saying that we are going to be short 285 billion rand. Now, that is money that could have come in handy. We're going from a fiscal point of view, we are in serious situation. And what we have done was to craft a 500 billion assistance, both relief and social and economic relief package to help to navigate vulnerable people in our country, as well as companies that are in distress. And this is clearly for a limited time. And some of the money we've had to loan, we've got to loan from a number of centers, like for instance, the New Development Bank, the African Development Bank, the IMF, the World Bank, and so including internal sources that we have to rely on. And to raise almost 11% of your GDP is quite a bit of money, and we've decided that we must have this. But what that also raises, Willem, is that there is a need for us to start looking, as I think other organizations have said, we now need to start looking at how we give assistance to our people who are in distress for a longer period in their own lives, where there is poverty, where there's inequality. And let me immediately say that a number of countries in the world are already saying, even those countries that were vehemently opposed to even countenancing a universal social grant of some sort, are beginning to countenance that. Now, COVID-19 finds us in a very dire situation where our economy has been in serious trouble, and with the downgrading, we're in much bigger trouble. We now need to find a number of ways to address all these challenges. But for now, this assistance will last for 6 months. We announced that we are going to give this assistance both to do a top-up on the child grants, the old age pensioners, the disability grants, as well as the grants to the special grant for unemployed people. So this is going to be available for the 6 months, and we've made that very clear right from the beginning. And obviously, we know we are going to face other challenges going forward, and it is for that reason that we say we now need to look at recovery, economic recovery that needs to address itself to precisely some of the problems that you are alluding to, Willem. How we address issues of unemployment and even issues of hunger.